capturing, aggregating, and translating enterprise data into knowledge. More than insights, actionable insights, the kind that reduce exposure to risk, enhance operational performance, and improve patient care. Greetings, everyone. It's Tuesday, December 9th, 2014, and welcome from the Technology Association of Georgia. This is Tech Talk, and I'm your host, Frank Baia. On this edition, we explore the many changes in the healthcare industry affecting your company, the biggest driver for improving healthcare delivery, and the complex, dynamically fluid healthcare environment where industry consolidation is continuing to impact the entire ecosystem, from healthcare provider to healthcare IT vendor. On this edition, find out the answer to the big question: is U.S. healthcare still the best available, and will it remain the best in the world? Up to the Tech Talk, Robert Watson, President and Chief Executive Officer of Streamline Health. Appointed to be the Chief Executive of the company in 2011, Bob has over 25 years of experience in healthcare information technology. As a CEO, a board member, and advisor to multiple companies, he's a former Chief Executive and a Director at DocuSys, and served as a consultant to several venture capital firms and growth stage healthcare companies. As well, Bob served as Executive Vice President of Business Development and President and Chief Executive Officer, as well as a Director at several successful healthcare companies that were later acquired or merged over the last several years. It's a Tech Talk all about meaningful, intelligent solutions, from patient engagement to reimbursement to advanced quality of life and the quality of healthcare, as we learn more about transformational data-driven solutions for healthcare with one of the industry's top leaders, Streamline Health President and Chief Executive Officer, Robert E. Watson. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions. Bob, welcome to Tech Talk.
Thank you. Very happy to be here.
Pretty exciting times for the healthcare industry. The dynamics are, I think, exponential. It's not phantasmagoric as far as the rapid changes that are going on. Let's take a look about that from your perspective. How are the many changes of the healthcare industry affecting your company?
Well, I think in general, the largest impact is clearly around a degree of uncertainty that the change injects into decision-making processes, into the behavior of our potential clients. There's a number of pretty dramatic sort of macro market forces at play right now. The looming implementation of ICD-10, the development of ACOs by many of our clients, the volume of data that's moving around today inside healthcare, not to mention the government activities in the background around meaningful use and the ICD-10 issue, which I already mentioned.
Go into a little bit about those acronyms. I think a lot of our listening audience are generally understanding them, but maybe be a little bit more micro in terms of what you're describing.
So ACOs, for example, we're talking about accountable care organizations. Essentially the macro market issue there is that we'll see that we are seeing that many of our clients are forming relationships with Walgreens or CVS or sometimes with payers and essentially carve out pieces of a population and to essentially manage them going forward. I think that creates a certain degree of uncertainty, and then frankly, from our perspective, many of our clients are unprepared for it. If you go back to the 80s when hospitals became payers, that, quote unquote experiment was a colossal failure. The accountable care organizations are another one of those, movements afoot that I think the jury's out whether it's going to be positive or negative.
Well, obviously the complications are pretty thick and broad. Maybe let's mine a little bit about some of the service solutions that you guys provide at your company and what Streamline Health's position is in the healthcare IT industry today.
Sure. Streamline's been around since 1989. Until 2011, we were primarily focused on what we refer to as enterprise content management, essentially managing the volumes of unstructured data, primarily paper, that surround the electronic record and making those data available inside the electronic record. Since that time, we've made a series of acquisitions that have expanded our portfolio, and around a thesis that the EMRs by themselves do a very, very good job at certain things. There's some things they don't do a very good job at, or things that, frankly, we think they could do a better job at. So we've tried to develop a set of solutions that allow us to address really primarily 4 areas. First is patient engagement, which is most notably our #1 ranked CLOS scheduling solution. The second area is clinical analytics. I mean, this is a growing, very nascent market of mining the clinical information in a form and fashion that you can deliver better patient care over the long run. Third area is our core, what we now call today our HIM, or Health Information Management and Coding solution set, which includes the legacy content management business as well as computer-assisted coding, chart abstracting, chart deficiency analysis, really the back end of the healthcare experience around the record. And then finally, we have a series of solutions in the financial management area, which are really about taking the information that's gathered during that encounter with that patient and helping our clients better understand how claims get paid, why claims are not being paid, what they can do to improve those kind of back-end workflows.
One of the things that always comes to mind when we're talking about disruptive technologies, I often think of what Steve Jobs said about people don't know what they want until they see it. When you talk about the solutions that you're providing, do your clients really know they have the problems? I mean, I guess my question is, how do you win business and clients, and how do you keep them?
So in the area, in the HIM and coding sector, I think our clients generally know they have a problem. I mean, ICD-10 is coming, right? So you've got to address that issue. In the scheduling arena, again, if we've seen a lot of consolidation in the provider industry, so as health systems buy other physicians' practices, other health systems, other hospitals, the margins are so thin they can't rip and replace the EMRs. And if you're in a market where you have responsibility for pool of lives, or you just simply want to maximize your throughput, you're going to want to have an enterprise scheduling solution that's able to schedule in all the different EMRs you have. So, for example, we have a client that has 9 different EMRs across their enterprises, and they don't talk to one another except through our scheduling solution. In the clinical analytics arena, I think that's an area where the conversations that we have today with prospects and clients are very early stage. We've been fortunate. We've had, to have some good uplift in that solution set this year. But that's an area where our clients are trying to say, hey, how can we know we have this data, how can we use it to do a better job of caring for our patients? And finally, as the payment models change, denials will go up. So you've got to be in a position in the financial management side to understand that when ICD-10 comes, you're likely going to have a lot more denials if you're a provider. So how do you manage that? So those kinds of conversations that we have with our clients and our sales prospects help us win new business and also, frankly, help us keep our clients.
Now, the impact of all the technology, the impact of all of the changes, obviously you've got deliverables, the expectation of what actually happens in patient care. A lot of conversation goes back and forth, a lot of debate, but obviously many people feel that the U.S. healthcare is the best in the world. Number one, I guess, do you agree with that? And if you do you see us remaining the best? And if you don't, what do we need to do as a country to provide our citizens the best healthcare in the world?
Look, that's a bit of a sticky wicket, right? I mean, I think most of us would agree that the healthcare delivery system in this country compared to other parts of the world is really quite good. Whether it's the best in the world, I'm not sure I'm going to take that battle on. But I do think we do a very good job of caring for our citizens. I think the challenge we have is the cost associated with caring for the sick and the injured in this country. And that's because the perverse and, frankly, idiotic payment models that exist today create challenges, and the incentives are not necessarily aligned between a provider, an insurance company, and the patient. So I think that's the challenge that, I don't know that it'll happen in my lifetime, but for my kids' sake, I hope it happens in their lifetime, that we figure out how to improve that.
Well, you've got some interesting dynamics in play. Number one, the industry is in change, and obviously with that, your business. I'm thinking you're not getting a whole lot of all-night sleeping going on. Tell us, maybe if you'll be candid, if you can, what keeps you awake at night as far as the industry, and maybe what keeps you awake as far as your business as it relates to the industry changes?
Well, I think, I think first of all, as it relates to the industry, I think the number one thing that causes loss of sleep for me is that any increased governmental intervention into all the things that are going on is going to create a higher degree of uncertainty, and I think that's a challenge for all of us. As it relates to Streamline individually, and I would imagine for my colleagues who are in the same position I'm in, the huge challenge we all have today is the human capital. I mean, as the demand goes for better IT infrastructure, better technology inside hospitals and health systems, the demands for a skilled workforce are really quite high. Here in Atlanta, I mean, I think the Chamber tells us there's 200 plus healthcare IT companies in metropolitan Atlanta. I mean, that's a lot of people looking, searching for that same pool of associates, and that troubles me. I mean, it's, if you look at our website today, we probably have half a dozen open positions that are posted, and there's probably more than that. I mean, it's just a very competitive human capital market here in Atlanta.
It seems to be a chronic problem across the board, and it almost doesn't really relate to any single vertical. I know that we're facing a lot of even high school computer science issues, STEM issues, graduates coming out of college, and even the programmers that are available, no less the specialization in health and health IT. So, it's an interesting scalability problem. If the opportunities are there, the challenges are there, and the growth is there, but not the human capital, as you point out. Well, the subject, we could go on for a lot. Bob, you sound like, without question, a subject matter expert we'd love to invite back. Thank you for taking a few minutes out of your busy schedule to join us today on Tech Talk.
Thank you very much for thinking of us, and again, thank you for your time today.